All right, hello, welcome back, guys. My name is Andrew again. So today I'm just gonna be doing a quick video on, it's psychology related, but it's gonna be on what a mental health technician does. So I am in my third year of applied psychology school to get my bachelor's, and I wanted to get some kind of experience in the field. So I literally Google searched, um, entry level psychology jobs online, and this is what popped up. So a mental health technician. I said, this sounds kind of cool. What do they do? Fancy title, right? So I literally applied on one of the job searches online, and this job was like 20 minutes away from my house. So I'm like, this seems perfect. I went and did the interview. Very extensive process. So it's in a mental health hospital. So for anyone who doesn't know, I didn't know this existed. I know I should for a psychology student, but I didn't. So there's a hospital, and most hospitals have a psychology ward. And then if somebody needs like acute care or long-term care, at least up to like a month and a half, we do about that time is the most. So 3 days to a month and a half, they'll get sent out on a petition. So a petition pretty much just says from a judge or somebody in the family or somebody that says this person needs to get mental health help. So right now I'm working on the acute unit. So there's a bunch of different units. Normally they'll have a kids unit, an adult unit. They usually separate males and females, but we actually have some units that have both. And then anyone who doesn't know, acute care is like, I would say it's like the more extreme psychosis and stuff like that. All right, so anyways, I applied for the job. I got it, yay. And then I had to get all sorts of tests. So I've done 2 TB tests. I had to get hepatitis B vaccine, obviously coronavirus, I think a flu shot. There's a ton of, just the tip of the iceberg. And then I had to go and do a background check, fingerprinting, a ton of, the training was 2 weeks long. And there was 1 week in literally like a classroom setting where I learned all about the procedures and stuff for the hospital. And then the second week I've been on and off the floor. So if you guys don't know, a mental health tech is literally the person that's on the unit. They do not call them wards anymore. That's kind of a no-no term in psychology anymore. So it's not a ward, it's a unit. So I'm on the adult male acute unit. So they are pretty much I don't want to say they're the most dependent. So I am literally going out every day. I'm on the unit making sure. We do 15-minute checks. So I'm assuming that this is pretty standard in any mental hospital, because a lot of them are on suicide watch, and a lot of them, they're pretty much on this unit because they're a danger to themselves or they're a danger to others. That's how you get petitioned to a mental health hospital. So I'm doing 15-minute rounds, they call them, and I'm literally checking on every single patient every 15 minutes and making sure they're literally breathing and not hurting themselves or anyone else. I hate to say that it feels like a jail in there, and I'm trying to limit that as much as I possibly can, but they aren't allowed to leave. A lot of people don't know this. Even if you check in voluntarily, at least in Michigan, you have to be there at least 3 days. So if you check in and tomorrow you feel better, you literally cannot leave until the psychiatrist checks you out that you're good to go. And you can go from 3 days to about a month and a half, I think is about the longest we've seen. And then we transfer them to a long care facility. The whole entire point of a mental health hospital is just to get the person, at least the short-term ones like I'm working at, is to get the person from having the crisis and not functioning in society, and pretty much get them on medication so that when they leave, they're normalized enough to be independent. We set them up with a social worker and a psychiatrist and then nurses, and the whole point, is literally just to get them medicated enough to where they're good to get to the next step. So it's like the first step of mental health care. I don't mind saying it, I get paid $15 an hour right now. They're also very short-staffed due to Corona and all this other stuff. So there are incentive shifts where I can get paid extra money per hour and stuff like that. If I pick up like a weekend night that nobody wants to work, I can get incentives, which is kind of cool. So it's literally 4 days a week is full-time here, in case anybody's wondering. I don't know if that's normal in the mental health hospital industry, but it's 4 days, 8 hours, so it's 32 hours is full-time. So I can get benefits on 32 hours, technically full-time. It's pretty cool. Can do retirement, match it, all that kind of stuff. So all the adult stuff that, you start to appreciate in job once you hit 25, 26, that kind of stuff. Unfortunately, I'm 25, so I'm feeling that. But it's good so far. I don't know. I'm not sure if I'm going to stay for very long. It's a lot. It's definitely a taxing job. You're in there and you learn how to watch your back and stuff, because you don't know. You're walking into these rooms and some of these patients are awesome. Most of them are really amazing. And then they'll kind of just have a moment of psychosis and they don't know which way's up and they're just gonna grab whoever's by them. So I was walking down the hallway the other day and doing my rounds, and I'm still pretty new, so it takes me a minute to make sure everyone's good, and I'm paying attention to the clipboard I'm holding, and somebody grabbed me from the back. Not to scare anyone, there's a ton of horror stories like this, but someone grabbed me and said, let me out, let me out. Not a huge deal, honestly. It's not like they were strangling me. We also are trained in that first week how to, disarm people if they're hurting you. So it wasn't bad. I didn't get hurt. All the nurses came over. So whenever something like that happens where someone needs to be managed, they call a code over the speakers, and the nurses come rushing, and the PCSs or mental health technicians come rushing, and there's always someone there to help you. So you're never alone. It's not scary once you get into it. And if you want to get into psychology, this is a great starting job because you're going to see a lot of psychology that you never knew existed. I highly recommend doing it and trying it. If you don't know where to start in psych and you're getting your 4-year in psychology, you're not into a master's program yet that includes some of the internships and whatever else it would include. I don't know, to be honest, yet. They don't teach this very well. I would do it. I would at least try to get somewhere in a mental health hospital. This is a great place to be. I'm literally one-to-one and face-to-face with the patients every day, right where I should be. I feel like the experience is incredible. Okay, so here's some of the stuff that are my concerns. The setup is pretty much everybody has to go on medication. It doesn't matter what unit they're in. Like my unit, it makes sense that a lot of people would be on medication because they're heavily psychosis and delusional, and they have genuine mental disorders that are going to be lifelong, I would think. So, and a lot of these people are repeats. So I had this guy the other day as an intake, and he's like, I'm trying to explain it and be really friendly, and it's scary when you're in a mental health institute, especially when you're there against your will. So I'm trying to be cool and just let him know what's happening and blah, blah, blah. And he's like, man, I'm good. I've been here like 5 times. So a lot of these people, they do need the meds, and they're going to go on the cycle of getting on the meds. They'll get out. They'll live their life. Like this guy, for instance, had been out for 6 months. He stopped taking his meds just because he thought he was good, and I get that. You think you're good, you're like, forget it, I'm fine, I don't need the meds, but they're the reason that you're good. So he ended up back, and he goes, I know why I'm here, man, I freaked out. He said he had a vision, and he started attacking somebody, and then he was petitioned to come back, and he's like, yeah, this isn't my first rodeo. So it's very interesting. I would have never known people like that were out there that, that had experience doing this, and it's a whole different lifestyle once you're in the system. So, but I also think there's people who don't need the medication. I had a guy come in with, I would say depression. He was just depressed. Tried a suicide attempt, and they're all serious, but it didn't seem, he had major depressive order, but I don't know if it was the right place, at least for him to be in my unit. He had a suicide attempt, tried to take a bunch of sleeping medication, but he didn't seem like he had major psychosis or anything, so he should have gone on a different unit. It was his first time in an institute. He wasn't, it's scary. So I spent time with him the other night, just making sure he was okay. I was giving him, feeding him, giving him some hot meals, because he'd been in the hospital for 2 days, and that's the last thing you want to do after a suicide attempt is be around a bunch of strangers that are annoying you in a hospital setting, checking up on you like a lab rat every 15 minutes. So it's cool. You can make a difference in this job, and I think that's awesome. That's the only reason I'm there still, because $15 an hour is okay. It's not the best money I've ever made, especially for putting yourself at risk because you don't know what's going to happen every day. So it's a cool place to be. I do feel like I'm making a difference, or I wouldn't still be here, to be completely honest. And it's just a good experience for the field. So mental health technician, it's also called a psychiatric care specialist. So in the hospital, they call them PCSs, which I thought was funny. It sounds like piece of shit, but I'm not going to tell the patients that because then they're going to call me that. I'm just kidding. But yeah, so it's called PCS, or mental health technician. Great job so far. It's a lot, so you've got to be ready. But if you're going to get into psychology and this is a real thing you want to do, the best way to test if you're serious about it, mental health technician, great job. If you guys have any questions, please let me know. I don't know what else to say. I guess I got the pay out of the way, the day-to-day stuff. I guess other stuff I'm doing other than the 15-minute checks, I'm making sure they're okay. We have all sorts of stuff behind the desk that they can't have access to at all times, like, certain things, just toothbrushes and extra towels and extra blankets, anything that could become a weapon, which here, anything, ask anyone that's been here a while. And it's so funny because they have stories about anything becoming a weapon. And again, 90% of the time we don't get to that point. So my hospital, and I think the industry anymore, is this is awesome. So actually here, I have a book. So before I really got into psychology, I read this book, American Therapy, The Rise of Psychotherapy in the United States by Jonathan Ingle. If you want to know about the horror, One Flew Over the Cuckoo Nest kind of stuff, this is it, with shock therapy and lobotomies and restraints and chemical restraints where they're given shots and stuff and horrible stuff that you would hear about, you know, in early stages of psychology, especially in the United States. That's a cool book. So that's when I came into this hospital thinking, the stereotypes in movies and One Flew Over the Cuckoo Nest and American Horror Story. And I'm not gonna lie, I think a lot of the stuff is absolutely true. This is a totally a nonfiction book. So it's interesting to know that and then come into a hospital and see that we don't want to lay hands on a patient. That's the very last step. Nobody ever wants to do that. So far I've seen a couple of them happen. And then sometimes, which I don't really know how I feel about this, medicine is court ordered. So if they won't take it willingly, I won't, but the nurses are forced to inject them. I don't know how I feel about that. But that's the only time I've seen, you know, a patient really struggle is when they don't want to take their medicine, and we have to do obviously nonviolent techniques to hold them down and then inject them. I hate that. The guy who grabbed me, he wasn't really being that rough, but he got an injection in the butt, and he was pretty loopy the rest of the night. I don't like that. I think there was other things to do before that point. I'm not a psychiatrist. I'm not a nurse. I'm literally the mental health tech. I'm kind of the bottom of the line here, so I'm gonna keep my mouth shut, at least at work. But that's how I feel. So it is cool. I've only seen that a couple times, and then we don't restrain people unless it's absolutely necessary. If they're ripping at their neck with their nails and trying to kill themselves, which I haven't seen anything like that, but bad example maybe. Or if they're beating up other patients, which that does happen. You know, they're in a psych hospital, so other patients get on their nerves, and some of these people just have bad emotional control. So it happens, but for the most part, everyone's cool. I haven't seen that much restraining or anything. That's just what you're worried about when you go in there, or I'm gonna get hit, or I'm gonna get spit on, or I'm gonna get attacked. 90% of the time, even with people with psychosis, you treat them with respect, and they're gonna respect you back. This is the information that I really would have liked when I started, and I did watch a video beforehand that was on YouTube. I'm like, that was really helpful, so I figured I'd post one. Any more questions though, please let me know, and I'll try to respond as quickly as I can, but that's about it. So good job, I highly recommend it. The industry is very interesting. I'm going to be doing more videos in the industry because there's a lot of stuff I don't agree with, and I think that there's a lot of problems in it, and anyone I work with agrees with that, but the resources are limited, so obviously that's a real issue that they have to deal with. But yes, this is the day in the life of a mental health technician. My name is Andrew. Please let me know if you have any more questions. Thank you.